the important advice in any vascular exam. When you're having an OSCE exam in vascular surgery, as an examiner, we are obliged not to do any prompting. What is mean by prompting? Prompting is not to give the candidate any either helpful or non-helpful information by facial expression. So, for example, if I want you to ask about causes of pancreatitis, for example, um, some of the Egyptian or Middle East trained doctors, they want you when you are enumerating the causes of pancreatitis to say yes, to give a smile, or to give anything. They are not used to have a mask face, and this makes them stops. So maybe they are on the right track in giving the correct answer, but because they have not used to have an examiner which is not agreeing with what they said or not laying back, they always take it on the wrong way. So they think that, well, I must have been giving a very bad answer, must be wrong. And some of them stops or even a change track. Um, Unfortunately, I think around maybe 50% of Egyptian candidates in London exam MRCS have failed yesterday in my station, which is not sure that would affect the overall grading. But the main problem was when I ask a question um, and I don't give any facial expression, I don't do any nodding. Yes, you are on the right track. I don't give any smile. They are not used to a mask face, and we are obliged as an examiner give you the question, and we just wait for your answer. We don't do prompting. If you don't understand the question, we can rephrase the question, but you wouldn't have any prompting. So please try to concentrate on your answer. Don't think the examiner will either give you a good noting that you are on the right track or a bad noting if you done anything wrong. We have a mask face. We don't do any prompting, and by this, I hope that you will get a benefit of the exam. The questions are really straightforward. We avoid any controversial issues, so no controversy. It should be easy to pass if you studied well from reliable books. It should be it should be easy. It shouldn't be difficult at all. But you need to be trained on OSCE station and how to present your skills. I will try to give more advices in a quick live videos, especially for MRCS candidates, for European board candidates, and for FRCS candidates as well. Um, there is increased number of candidates. Now the Royal College of Surgeons of England have nearly one exam every day, which is uh, which is really very helpful for you to get all the big numbers having their examination, and this is very very helpful, and they are helping you to pass, giving you a good advice. The OSCE station are changing quite frequently, so you will get a new OSCE station. All of them go into testing phase, what is called pilot phase, and then once they are secure, there's no problem with the station, then it will go through. Again, you need to show professionalism, and this is very important. How you introduce yourself to the patient, how is your body language, how to explain what you are going to do if you're going to examine cranial nerves. And please, one of the very important advice, whenever you have an examination of a certain area of the body or certain system, you must have a scheme. And this is a problem with a lot of candidates. They don't have a scheme. So you must train yourself. If you want to do an abdominal examination, you will do from step 1 to step 15. And then you are sure that you have done it hundreds of times. So it becomes like a normal reflex. And examination of cranial nerves, from 1 to 15. A lot of the time I see a candidate, when we ask him, let us examine the cranial nerve of the following patient, he doesn't know where to start. And if he get one test, he doesn't know what is next. But the professional candidates that they will pass, they already got this system built in. And this is very helpful. Morning. This is extremely helpful for all candidates to pass. I wish you all the best.